the last time I called at 3 to let them know.
All right, well, welcome everyone. We are recording already. Are we good to go ahead and get started, Christy, or should we wait a little longer?
I'd say let's go ahead and get started.
Okay, great. So welcome everyone. Thank you for joining us for our first training session of the year. We are so excited to have everyone joined here today, and we have a special guest for our first training session. And so a little bit more about our guest speaker today. We have Dr. Tese Stephens. She is a nurse educator, researcher, and consultant. Her work is focused around resilience. So a little information about why we chose this topic for our first training session. We were doing a little bit of research about the Connor-Davidson resilience scale, and we came across Tess's work. And we were just so impacted by how much it aligns with the work that all of our members are doing, and a good topic that is going to come up in our community outreach grant. And so she is the author of Stephen's Model of Resilience and founder of Chief Boat Rocker, RN P.R.E.P. So we are super excited to hear about her work and kind of how that aligns with a lot of the work that our members are doing. A lot of her work is centered around narratives of Holocaust survivors. So we're definitely going to be excited to hear more about that work as well. So I am happy to pass the baton over to Tess and for her to share with us her presentation today.
All right, well, thank you so much, Diamond, and the team here. It's really a privilege to be with you all today. I admit that I did not know a lot about your organization. I am a Tennessee resident, but I live part-time in South Carolina and have been spending the majority of my time in South Carolina, even though my permanent residence is here in Tennessee. So I looked you up on your website and learned all about you, and I'm so impressed with the work you're doing, and just an opportunity to meet with people who share values and have this like-minded approach to healthcare. So thank you so much for inviting me. I am going to give you just a very high-level overview of my work, and I welcome your questions. I'm not sure if there are any healthcare professionals or providers in the audience, so I'm going to keep it pretty general, just kind of an overview of where I've been and where I'm going with this work. So I'm going to go ahead and share my screen now. Give me a thumbs up if you're seeing the slide with the tree on it. All right, awesome. Okay, good. So the title of the presentation that I'm going to give to you today is something that's evolved over the past 2 decades, really, since I began this work. And it's all about developing what I call a resilient mindset. And I use this tree in most of my workshops and in the courses that I've developed. And if you look at this tree, I think from the way I define resilience, that it truly does embody the characteristics of what it means to be highly resilient. Do you think this tree's had an easy life? No, it hasn't, has it? I live on in the low country in South Carolina. We have a lot of live oaks, and it's not unusual for us to see the roots and all of that above ground, but we don't see this kind of root showing very often. This tree has experienced some adversity, something that has caused the soil to wash away from its root base. But if we look closely, we can tell that this tree didn't die, did it? How do we know it didn't die? It still produced foliage, right? It still continued to grow. And in fact, because of the adversity, the stress that it experienced, we can look at its roots and see that not only did the roots that it had already in place hold it in place, but it grew new roots that helped to stabilize it. And that's essentially what resilience is it's growth through and from stress and adversity, the potential for that. And to do this, one thing that I have learned with my research and my work is that we have to have the right mindset. And that's what I call the resilient mindset. So we're going to go ahead and move through this pretty quickly. Diamond, are you monitoring questions or chats, or do you want me to do that at the end? How do you want to handle this?
We'll monitor the chat, but I
Okay.
think we can wait till
Yeah.
the end for questions.
Okay, yeah, just interrupt me if you need to, okay? Because I get going and sometimes I'm not paying any attention to what else is going on. So what does it mean to do something on purpose? And I'm not going to poll you or anything right now, but just think about that. If you say you're going to do something on purpose, what does that really mean? Now, I have 2 grandchildren and one on the way, and the 4-year-old is a lot like her noni. She has a mind of her own. She's a little bit hard-headed and what might be described as willful. And I'm very proud of that in her, actually. So, but she will sometimes, if her parents are calling her down for something, she'll say, "It was an accident. I didn't mean to do that." And they will say, "Absolutely not, Emmy. You did that on purpose." And so what does it really mean if we do something on purpose? It means it's intentional. It was not by accident. We wanted that to happen, or we planned for that to happen. And when we made a decision or a choice or took some sort of actions, it was with an end goal in mind. And that is what we're going to look at in relation to a resilient mindset, is how possessing a resilient mindset leads to a more purposeful life. And I'm going to share with you some of the things that I've learned over the past 2 decades in researching this concept of resilient and learning how I can teach it to nursing students, nursing professionals, to healthcare providers at all levels. I've used it with medical students, with pharmacy, with psychology, with OT, PT, just about anybody that's in the healthcare profession, social workers, that helps us navigate the stressful environments that we work within. So let's step back just a little bit. This was me in 1986 as a brand new nurse. And I will tell you that I was so happy to become a registered nurse. I had actually moved from pre-med chemistry major to nursing because I felt like it fit me better. And I had thoroughly enjoyed my education, my academic experience, and I was excited to pass my licensure exam and move on into the practice setting, and just really, really excited to be there. But one thing I realized early on in that process was that not everyone else was excited to see me. And my enthusiasm was not the norm where I worked. Let's just put it that way. I soon discovered that this was not just me, but it was a lot of other new graduate nurses. It was a lot of our medical residents, medical students, just walking into a work environment that was not what we expected it to be. We knew work in healthcare would be stressful. And my first 20 plus years in practice were mostly in the ED trauma setting. So, very chaotic, a lot of energy, a lot of, bad things happening, facing things with families and patients, but I expected that. What I didn't expect were the other things that led to a lot of stress and a lot of moral distress for me as a nurse. And I made myself a promise early on in that very first year as a nurse that if I could ever make a difference in the lives of other new nurses, and I was only thinking about nurses at that point, that's evolved, but that if I could ever make a difference, that's what I would do. So I did everything that I could in the practice environment as an administrator, as an educator, as a preceptor, in all the roles that I could, until finally I realized I really needed to advance my degree and get into academia where the problems were beginning. So I first discovered the term resilience as far as really looking at the term as a graduate student. And I was looking at the high rates of nurse attrition from an administrator standpoint. And at that time, we were seeing new graduate nurses leave their first place of employment within the first 2 years. Approximately 60% were leaving, which is of great cost to the individual, but also to the organization. And my attention turned to the 40% or the approximate 40% that did not leave. Why did they not leave? Why did they stick it out? They were facing the same challenges, in the work environment, but for some reason they persevered. And there wasn't really anything in the literature beyond just saying they are resilient. And I didn't understand, what does that truly mean? Of course, I had heard the term resilience my whole life, but what does it really mean? And why does it matter so much? Why does it make such a difference in these outcomes? There wasn't a really good definition. There were lots of different theories on what is resilience. Can it be taught, or are you just born with it, etc. But very little information in the medical field or in the medical and nursing journals. So I immediately went on to the University of Tennessee for my PhD, where this became my focus of research. And I learned that there still wasn't a lot out there. So I ended up having to develop a conceptual model that would guide my research and work in this, specifically as it related to nursing students and new graduate nurses. It's since evolved, and we use it with healthcare professionals all across the board, because I'll tell you, it's not really rocket science. I think I shared this with your team leaders the other day. My son is a rocket scientist at Duke, so I know that what I do is not the same as what he does, but still it's very, very important. And my essential questions, my first initial burning questions as a researcher were, can we teach this? And if so, how do we teach this? How can we teach this most effectively so that nurses and other healthcare professionals can increase their own personal resilience before they ever enter the workforce and be able to better successfully navigate these challenges that we face? So I did this work, a lot of this prior to COVID. And at that time, burnout was a problem even before COVID, and moral distress had been on our radar, specifically related to nurses since the early 90s. And when Jamison defined it, it was specific to nurses. So we've been talking about burnout and moral distress in healthcare professionals for a long time, but it didn't reach the crisis point until just before COVID. Many people think that it just became a crisis since COVID, but actually it happened before COVID. But it wasn't on everybody's radar, and it wasn't at the levels it is now. So before COVID, before 2020, when I was doing these workshops, it was more about the acute stressors that we face, the things that we may face for a few days, a few weeks, a few months within our organizations or certain systems, or personally even. And then we go on with our lives, and then we, face the next challenge as it comes. But what we've learned since COVID, since 2020, is the fact about burnout is related to chronic workplace stress. It doesn't go away, or we don't see any sign of it going away. And it's a different type of stress, and it takes a different toll on us as caregivers, as providers. So we have to look at it through a different lens now and really pivot in how we're approaching this in protecting ourselves and protecting our colleagues. It can also be translated into the clinical environment in teaching our patients, but we first have to put the oxygen mask on ourselves and build our own resilience so that we can better take care of others. So this is how I define resilience, and this was originally published in 2013, and then it's had several iterations since then. And I typically don't read my slides. I think that's insulting, but I'm going to read this one to you because I want to highlight certain phrases. These words, I will tell you, this was years of work in coming up with this definition, and the choice of words was very intentional based on the evidence. So it's an individualized process, meaning it's going to look different for every single person, depending on who you are, your past experiences, your current experiences, how you were raised, your beliefs, your value system, your prior experience with adversity or trauma. All of this makes it individualized. So there's not a one approach for everybody, but there is a path, a strategy that I share that is the same, but within that, everyone has to kind of find what they need to do based on their own self-awareness and self-assessment. Process means it doesn't happen overnight. In my first study, when I was actually doing an intervention to see if we could increase resilience, and I was using multi-sites to do this study, we found that there was a high rise in our resilience scores, and that's, I did use the Connor-Davidson instrument for that study and several others as well. We saw a great increase in our experimental group in the levels of resilience, but what we found is that within 3 months of stopping the intervention, they had gone back down, not to the previous level, but still they had gone back down. And this led us to really look at this process, that it's a skill, and it's like developing a competency. Anything, if you're a provider or any type of skill you have had to learn, it takes time and practice before we really develop this as a competency or as a skill that we can put into use over and over again. So the repetitiveness of the process is very important here, that it's something that is integrated. And in nursing and in medicine, we see the call for, on a national level, this content being integrated into curriculum so that it can be taught throughout their cycle of education and then reinforced during the residency program and in the practice settings. The next word I want to focus on is development, and this means there's a potential for growth. So it's not just bouncing back like a lot of people believe, and sometimes if it's a minor stressor or minor adversity, it may look like we've just bounced back to a previous state because the adversity was not that intense, and we don't seem that different. But as biological beings, we know we're constantly changing, and that we are never truly the same after an adverse experience. So there's always the potential for development, for positive growth, or some type of regression or harm that can occur from that stress or adversity. The way it occurs, the way we develop resilience, is that during the time of adversity or stress, we use what are called personal protective factors. These are essentially healthy coping skills. And these are the behaviors or characteristics that we frequently see in highly resilient individuals. So if I'm measuring your personal resilience, I'm going to be measuring your protective factors. And these, I'm going to show you what some of these are in the next slide. But highly resilient individuals draw on these personal protective factors during their times of stress or adversity or trauma to successfully cope with whatever the situation is. So it's a response in the moment that leads to cumulative successes. So each time you do this, each time you call on these healthy coping strategies in the moment, it gets easier and you get better at it, just like any skill that you're learning. And what happens over time, this is why resilience is so important and why it makes such a difference, and why we see the benefits of resilience really in a very holistic way, physical, emotional, spiritual, is that it enhances our ability to cope with future stressors. We do better, we have better outcomes with the challenges we're going to face in the future, but also it enhances our overall sense of well-being, which is a really great gift for healthcare professionals. And the research shows that people with higher levels of resilience have lower incidence of heart disease, depression, anxiety, decreased sleep issues, less issues with addictive substances, etc., lower levels of hypertension, lower medications for all of those diseases. So it really does have many benefits to the individual. If you've read the book, The Body Keeps the Score, you will see that there are definitely physical, pathophysiological responses to stress that show up in our physical health. I actually get to speak with him in April, and I'm so excited about that with the trauma conference. But we know that stress and adversity filters out into all aspects of our life. So these are the most common personal protective factors that we see in highly resilient individuals, specifically healthcare professionals: faith, humor, self-awareness, flexibility, perseverance, a sense of purpose, social support, positive emotions, hope, self-efficacy, knowledge of health behaviors, self-esteem, courage, curiosity, adaptability, and competence. Now, we don't have time for me to go into each of those today, but if you have an interest in learning more about these or doing a little self-assessment on yourself, I'm happy to send a worksheet to the group leaders, and they can share that with you, to where you can kind of look at yourself and see, which of these do I possess and which ones do I need to enhance. This is your stress response toolkit, really. This is really looking at you and how you typically respond in a stressful moment, and changing that and adapting that so that you have better outcomes. So they mentioned a little bit about my work with Holocaust survivors, and I'll explain how that came about. So at the beginning of my work, I was wholly a quantitative researcher. I love math, I like numbers, I love the experiments, really love data analysis, everything to do with quantitative research. But as much as I loved it, and as much as the data was informative, there was something missing. And it was the human element. And I really wanted to understand from a human standpoint, what does it really mean to be resilient? How do these people think differently? How do they look at life? How do they approach a stressful situation? So I began looking and talking to different people. And as I mentioned before, my background clinically was trauma and emergency. So I had, remembered some of those stories and talked to people that had gone through some situations, talked with people who had was undergoing cancer treatment. My best friend at the time was going through cancer treatment, and she's certainly highly resilient. I was doing some volunteer work in Haiti at a hospital and with a nursing school there. And gosh, so many opportunities to really look at highly resilient caregivers in that environment. But I had grown up learning about the Holocaust. I'm not Jewish, I'm Christian, but my mother was deeply involved with some Holocaust organizations. And so I had grown up hearing those stories and learning about the Holocaust. And I was connected with the Tennessee Holocaust Commission, as well as a few other Holocaust organizations within the United States, which led me to going through some training, becoming a Belfer Fellow with the United States Holocaust Memorial Museum. And that in turn led to me making connections and developing relationships with survivors here in the US and in Eastern Europe. So I began going to visit different survivors across the US and, like I said, in Eastern Europe, and gathering their stories, their narratives of how they viewed their experiences prior to going into the concentration camps. So a lot of them were taken to a ghetto first, and then the years that they spent in the concentration camp, and then post-liberation, because the stress and adversity didn't stop for most of these. They were put into a internment camp. And so it continued on even though they were outside of the concentration camp. And after spending years, getting to know these people and them becoming like family to me, I really was able to see inside their way of viewing things. And this is where I coined the term and really started thinking about resilience being a mindset. It's a complete way of looking at life. And it's a shift that requires intentional effort for most of us. For some people, it comes more naturally. And these individuals, many of them, they had been this way since childhood. But we do know that any of us can do this. We can all become more resilient and shift our mindset to where we move from a victim mentality to a victor. So we regain control. A lot of what we see with our healthcare professionals is a loss of control over their lives, and they feel helpless and hopeless, which is a terrible place to be. And this is why suicide has gone out the roof for physicians and nurses. It's a lack of hope and feeling trapped and not knowing what to do about that. So the resilient mindset is a powerful tool, and something that we have to learn and teach, again, over time in order to do that. So resilience is personal growth. It's an opportunity to learn from and through adversity. It's a choice. Not everyone's going to choose this. It's hard sometimes to choose that path. a lot of times we just resort to our normal reactions to stress, and those often are not healthy. For me, if I'm really, really stressed, I isolate, I eat unhealthy things, and I don't exercise. I just want to sit on the couch, watch Netflix, and eat mac and cheese. That is not going to serve me well, except just in that moment when I get a little bit of an endorphin rush and I'm feeling a little bit of happiness from that moment. In the long run, it's not going to help me. So it's making choices that aren't easy. It's also really related to our career and finding where we fit best. And this is one of the things I teach in the course, the RN Prep course, is really understanding that we're not meant to fit everywhere. And sometimes it requires us to make difficult choices to really mitigate our risk for burnout, but most importantly, promote well-being and professional fulfillment. It is contextual. We will have ebbs and flows during our journey in resilience. It's not a linear path, and we shouldn't expect it to be. We are human, and we're going to have those low moments, and we just have to give ourselves grace. We also have to be willing to give each other grace in this process and recognize that, we're not perfect, and it's okay to not be perfect. Sometimes resilience is resistance, and it means standing up and speaking out against the status quo. And this is something that we're really fighting for in the nursing profession, is understanding that we have to change the systems. And we understand that burnout is a systems issue. It is not a personal issue, but it's because of chronic workplace stress that needs to be changed. The way we work needs to be changed. And this is true for physicians and other professionals as well. Resilience is individual. So it's about personal resilience, putting on that oxygen mask for ourselves before we reach out to help others. But it's also collective. And the bigger the change issue, the bigger the problem that we're facing within our organizations, where we really need to advocate for change, truly radical, transformative change in how we work, that's going to require collective response. And I have a whole other area of work on that, on building resilient teams that really do move the mark and really help us go in a positive direction for systems change. Resilience is not victim blaming. It's not saying you're not strong enough, you're not tough enough, you just need to do this or do that, or here, go meditate a little bit, or let's go get a massage. All those things can help, but that's not what resilience is. Resilience is a mindset, and really looking at how you are going to respond to the stress and adversity. It's not easy. It will require change in your own life. It may require change in your situation. It is not acquiescence, just sitting back and accepting the status quo and saying, well, there's nothing I can do about that. I just have to deal with it. That's burnout. And it's not conformity. It's actually about using your unique skills and talents to move change forward. And we've already talked about that. It's not simply bouncing back, and it's not a panacea. It's not going to solve all our problems. It is a step in that. And the National Academies of Medicine, in their initial burnout report, talked about a systems response to addressing the burnout crisis. And personal resilience is one part of that. The rest looks at changing the system and changing the way we work. So as a result of my work with the Holocaust survivors, all of those protective factors that we discussed started making more sense to me. Prior to that, they were each individual tools or coping skills that we needed to build, and I understood that, and I was teaching that. But they started to fall into these 4 categories, and I started seeing that they overlap many times. So I would talk to one individual, and purpose would come out in multiple places, priorities. But within each of these 4 categories, I would see self-awareness, self-regulation, perseverance, humor, faith. All of those protective factors started to make so much more sense, and the picture came together for me. And this is now how I teach resilience, and I teach individuals to enhance their own resilience. And when I do the workshops for resilient teams, we use the same 4 Ps, we just apply it to a team perspective. So again, we don't have time to go through these in detail, but I am going to give you a very high-level overview of what these 4 Ps mean. So I do a lot of references to Viktor Frankl, who was a physician, a psychotherapist, a neurologist who was Jewish and actually survived being imprisoned in the concentration camps. He lost his wife while he was there, but while he was in the camp, he wrote a book called Man's Search for Meaning. Some of you may have read that book. And essentially, meaning is purpose. And he questioned a lot of the things that we experience in life, but he took it from that very, very tragic time in his life. And how do you find meaning in adversity, in stress, which is essentially finding a purpose? And this has come through loud and clear in everyone that I have interviewed who have had really stressful situations, tragic situations in their life. In my own life, I've faced 2, and with both of those, I came to know personally how important purpose is. So you're seeing on the right side of the screen 2 little girls who are being led out of the concentration camp. This is in Auschwitz. This was on the day of liberation. And if you were to pan out, this arm that you're seeing here on the left in the kind of a striped looking uniform is actually a Red Cross nurse who was sent in to liberate these children. And these were children who were part of the Mengele experiments. Joseph Mengele, who was the physician that did the horrible experiments on different types of individuals, and twins were one of the groups in the name of research during the Holocaust. And Eva Kor was one of my friends and one of the survivors that I became very close to, and she was the experimental twin. She is the one on the left. Her twin sister Miriam is the one on the right, and she was the control group twin. And when I would talk with Eva, she was a spunky little thing. She passed away a couple of years ago, but she was a spitfire, really. And she talked about that, despite the horrors that she faced as a little girl, undergoing those medical experiments without any type of anesthesia, that she had to stay alive. And in fact, at one point, she overheard them speaking, and she understood German. She overheard them speaking, and the other attending physicians were saying that, were predicting when she would die based on the experiments they were doing on her. And the goal behind this was that they were going to autopsy Miriam at the same point of death when Eva died, to see if she had, what the differences were in their organs and in their tissues. Now, they never recovered the documents because they were burned when the Allied forces came in. The Nazis burned the records, but based on her latter health problems, it looks like she was injected with biological toxins in her extremities. And from looking at her, it certainly looked that way. So extreme pain, high fevers, delirium. She was a very, very sick little girl. And I asked her, I said, what kept you going? How do you, as a little girl, find that inner strength to keep going during that time, especially when they are giving you hours to live? And she said, I wasn't going to let them win. I had to survive for Miriam. She was weaker than me, and she would have not survived if it hadn't been for me. So her will to live, her purpose, was very strong, and it drove her to get through those terrible days. And as Viktor Frankl said, the meaning of life differs from man to man, from day to day, and from hour to hour. What matters, therefore, is not the meaning of life in general, but the specific meaning of a person's life at a given moment. And we use this to define purpose and meaning in work. And one of the things that I do with healthcare professionals is I talk about the difference between your big purpose and your work purpose. And it's important to separate the two. The life purpose, why were you born? Why do you exist? That's a very big philosophical, theological discussion that I don't get into with people. I have done that journey myself. It was very important in my own path, and I encourage others to seek that out and to understand that. What I talk about is finding meaning in your work and knowing that. And why that is so important is because it really does lower your risk for burnout, and it leads to a greater sense of professional fulfillment. Sense of purpose or meaning in work is defined as a stable and generalized intention to accomplish something that is at once meaningful to the self and of consequence to the world beyond the self. This is critically important with healthcare professionals because we're a service-oriented profession, and it means that we find meaning, we get a sense of purpose in doing for others. And one of the reasons we see such high rates of burnout and moral distress in healthcare professionals is that they are not finding purpose or meaning in their work. They are doing tasks most of the day that have nothing to do with the reason they became whatever role they're in. They've been taken away from what they truly find purpose in. And this is an important skill to understand and to put into your own life when you're making decisions about where you work, how you work, what types of responsibilities you take on, what you say yes to, what you say no to. Because this purpose in work, professional purpose, is essential to develop what we call professional fulfillment, which is a state of mind where you feel invigorated, you're dedicated to it, that you enjoy it, you find meaning in that work. And the latest research shows that if we are able to find purpose or meaning in our work a minimum of 20% of the time, it greatly reduces our risk for burnout. So this means that we can never expect to eliminate all the drudgery from work, okay? That's just not going to happen, not as a healthcare professional. There's going to be aspects of the work we don't love. That's life. But we can be more intentional in choosing where we work and how we work by really focusing on asking ourselves, can I fulfill my purpose at least 20% of the time in doing this? To do that, we have to be very informed about the work itself and ask the right questions. And this is an activity I do with students when they're looking at their residency programs or their first placements or where they're going to go, is don't just look at a job in general. Look specifically at the culture. Look at the actual work that you're going to be doing, and does it fit with your purpose? I recently completed a study. It's in press right now, and we looked at 700 nurses across the U.S. and Canada, and we looked at the relationship between resilience, purpose, and moral courage. And what we found was that there was a direct correlation between all three. And this is very big because we thought it was important that if we are promoting resilience, that we needed to talk about moral courage and purpose. But now we know that they go hand in hand. And one of the things that came out of this is how important it is to remember that what matters to you matters. It may not matter to anybody else. And you may sometimes feel like it shouldn't matter to you, but it still matters. And understanding your purpose, naming it, is of great significance. And the purpose scale that we used to measure was the meaning of life scale. And it is broken down into two subscales. The presence of purpose is what's moderately correlated to resilience. This means you know what your purpose is and you understand it and you have that in your life. You're aware of that. The other subscale is completely opposite, and that is seeking. That means if you don't know it and you're just seeking it, it has the opposite effect. In the evidence, we see over and over again that people who are just seeking their purpose and don't really know what it is have much higher rates of depression, anxiety, and lower levels of resilience. So this is why it's so important that you do those exercises and that you do identify your purpose. And I have a little activity that I do in my courses. I'm happy to share. You can also find these, all over the internet. Simon Sinek has a really great YouTube video on finding your why. Some people call it that. Mine's a little bit different because it's specific to work life. But really just understanding that core element of who you are, because it really does drive your satisfaction in work and your contentment and your well-being. The second P are your priorities in life. And there's two parts to this. What matters to you, those priorities, those things that truly matter most to you, and then your core values. And the slide that you're seeing now, excuse me, I'm going to take a drink of water. The slide you're seeing now was taken in the Theresienstadt concentration camp just outside of Prague. And one of the survivors that I work with is the youngest child survivor of this concentration camp. It's also called Terezin. And she, last time I was going over, she asked me if I would take a picture of her bunk. And so I was really intentional in the different places within the camp that I visited, and it led me to this processing room. And you're just seeing one part of this, but if you were to span across the room, you would see that all four walls of this room are just stacked with luggage and personal belongings. And this is where, when the prisoners were first brought in, all of their belongings were taken to this room. Now, of course, they didn't get their belongings. And what normally happened from the stories that I've gathered and from the readings that I've done, when people were being taken from their homes, either to the ghetto or a concentration camp, they were given very little time to prepare to leave. And they were usually told, that they had to take what they could carry with them. Now, some were able to use a horse and buggy or some other types of transportation, but for the most part, they had to carry it. So luggage for the adults, and the children often stuffed things into pillowcases. And I always ask the survivors, once I get to know them well enough, what did you take? And like for Inga, the one that is my friend that is the youngest child survivor, she took her doll and a couple of other belongings. But when I was standing in this room and I look at this picture frequently, I think about, what would I take? And this is a question I ask in the course. What would you take if you were leaving and you didn't know you were coming back? And it didn't have to be the things you could carry. Okay, so you could take humans with you or animals, whatever you want to take. If I were to ask you to choose 5 things or people to take with you, what would you take with you? That's a window into your priorities of what truly matters to you. And I'm going to show you a quote on the next slide of why this matters so much. Often as healthcare professionals, we get tied up in the stress, the chronic stress of work, and we're not able to give our time and energy to the things that matter most to us, our priorities. In fact, when we're so overwhelmed with that chronic workplace stress, it carries over into our home life. And even if we are away from work, we're still thinking about it. We're not fully present with our priorities. So we have guilt, we have anger, we have resentment, all of these things that just compound the stress. And in the technological advancements that we've had, this being, a chief one, we never really disconnect. And there's a crisis in healthcare professionals because of this, because we're always on and we're never fully able to disconnect. And so we struggle a lot with all of these things that take over our lives that aren't truly our priorities. Now, work is a priority, but it pushes all of the other things that truly matter to us to the side, and we never really feel like we're giving to those things what we need to be giving, what we want to be giving. The second part of priorities are our core values. And our core values are so important that we understand them and we name them. We identify them. That's that part of self-awareness as a protective factor, because they drive our decisions and they drive our reactions. Core values are at the heart of conflict within interprofessional teams, within teams in general. And there's often a misalignment between our personal core values and the places that we go to work. This is another strategy, a tool that we need to teach to our healthcare profession students, is understanding that you're not meant to fit everywhere. Your core values should be considered when you're making any decision about work and looking at how does the organization live out their values? What do they say are their values? And then what does it look like based on their decisions and their actions? The same with looking at leaders. If you're going to work for a new leader or you're going to be choosing a leader, what does their life say, their actions, their behaviors, their decisions say about their core values? Are they consistent with mine? This is where you can reduce your risk greatly. Prevention is truly greater than a cure. So we want to mitigate our risk as much as possible. And when we combine the 2 P's, purpose and priorities, when we're making any type of decision, we truly can reduce our risk in those ways. Jay Kaplan says that burnout comes from a loss of connection to our patients, if you're faculty, to your students, to ourselves, and to those we love, our priorities and our purpose. Too often in healthcare today, we focus just on tasks, just doing this and checking the boxes and doing everything that's expected of us. And we never really seem to be doing what our patients want, what our students want, and what we really crave. And that's in fulfilling our purpose and feeling connected to the things that really matter to us, our priorities. To do this, to really make sure that we are focusing on our purpose and our priorities in our work, we have to set boundaries. And I don't know about you all, but I've struggled with setting boundaries in my professional life. Part of that is because I'm a nurse. I've been a nurse for 36 years. I'm a boomer, and I was brought up and taught that nurses, a good nurse is someone who's obedient, who doesn't question authority, who just follows the rules, which is exactly the opposite of what a good nurse is. But that was the culture that I was taught in. And we're really working hard to change that, because we have to really improve how nurses are taught to think and reason and use clinical judgment to improve the quality and safety of patient care. But really, it applies to all healthcare professionals, that we all have to be willing to set some boundaries in our lives, professionally and personally, so that we can remain connected to our purpose and our priorities. The 3rd P is perspective. And the goal is to develop an informed perspective. And often what happens when we're facing stress or adversity, we have that stress response and everything gets clouded and we just knee jerk and go into just reaction mode. And oftentimes we react based on, just childlike responses, things that were developed in childhood. Again, like I said, unhealthy coping strategies that I've had my whole life that have never gotten me anywhere positive, but I just tend to go back to those if I'm really, really stressed. So what we have to do is, this is an intentional skill set that I work with individuals to develop, and I have to practice it myself. And I will tell you, everything that I'm telling you, I have had to learn myself, and I have to reinforce every single day. But I love this quote by Thoreau. It's not what you look at that matters, it's what you see. That's perspective. So we have to make sure we're seeing things appropriately. Okay, that's the informed perspective, and not making a knee-jerk reaction based on limited information. And how often do we do that when we're stressed? We just jump right in, and then we're in worse trouble than we were if we had made an informed response. So we have to put it into perspective. Whenever we are facing stress or adversity, we have to reframe it and then maintain that informed perspective. And I'm not going to give you a pathophysiology lecture today, but you know that what happens is whenever there's any type of stimuli that the brain perceives as a threat, and this is before we've even really acknowledged what's happening, there's alarm systems that go off. Those stress hormones start going all throughout our body, and we start feeling the physical effects of that alarm. And we go into that fight, flight, or freeze mode where we feel like we need to respond immediately. There's something happening, there's some sort of threat, and only you know how you react to stress. I have a certain way that I know the minute I start feeling certain symptoms, I know that my alarm has gone off and that I am reacting to stress through a very highly emotive state. So the first step in developing an informed perspective is self-awareness. There's your personal protective factor. And to do this, you just pause. I wear a necklace, you can see here, that has the pause symbol on it to remind me always to pause and to step back to make an informed decision and not a knee-jerk reaction. So self-awareness is your first step. What am I feeling? Give it a name. Is it anger? Is it worry? Is it fear? Is it anxiety? What is it that you're feeling? Give it a name. And this cognitive work that you do in naming it and thinking about it and assessing it, that in and of itself can help to lower the stress response. Okay, get your mind off the emotion and you move to a logical place where you're analyzing your reaction. So give it a name. What am I feeling right now? What is my body telling me I need to do? Is it telling me I need to fight? Do I need to run away? Or do I need to just freeze and isolate? What are you getting this feeling that you need to do? Okay, that it's going to help you analyze the situation. Then, has this happened to me before? Probably it has. And what did you do with it? How did that turn out for you? Thinking back to that, what would you have done differently? Do that now. What do I need to be telling my brain? I typically tell my brain, just as a default, feelings aren't facts. Calm down. Stand down, soldier. Figure this out. Get your facts before you react. Okay? So step 1 is self-awareness. Step 2 is situational awareness. I spent a lot of time in the water, and I spent a lot of time with surfers. There's always a threat of shark. So that's always in my mind. This guy here is completely oblivious to what's behind him. And in healthcare, we're taught to be aware of our situation. You know, like I said, my practice, I was in trauma, and we always go in and we survey the scene, right? You all heard that? And see what's going on. What are the threats? What are the risks? Could there be someone here that's got a weapon? Is there chance, if there's water on the floor, of being electrocuted? All these things we have to survey. But how often do we do that for ourselves? It's important that we survey the situation before we make a response. And this is simply understanding the meaning of this situation. When you're triggered, when you've got a response to something that it's stressful or adverse, there's meaning in the moment to this. Okay, then that's what's affecting you right now. But it also, you have to look at what is its future effects or potential effects. What is this going to mean a week from now? 2 weeks from now, a year from now, 10 years from now? You have to put it in perspective. Is my initial reaction to this aligned with its true impact? Oftentimes it's not. We're overreacting, but sometimes it is aligned. And that's when we have to really be informed in how we choose our response, because we want to lessen the future negative impact as much as possible and choose the right response. And this is where it helps to have that informed perspective. Another quote by Viktor Frankl: between stimulus and response. So when the trigger goes off, the alarm goes off, there's something happening here. I've got a situation that's causing me extreme stress. Between that moment and when we respond, there's a space. And in that space is where we're gathering the facts and gathering our information so that we choose our response. And this gives you great power and freedom. This is where we regain control. Many times when I'm working with people who are suffering from burnout or moral distress, they feel like they've lost all control and they have no choice or ability to make decisions anymore, that their life has completely been taken out of their hands. But we can always choose our response to a situation. Always. No one can take that away from you. So that's truly where we regain that control in how we respond. And sometimes the best response is no response. I've learned that myself, that if I give myself time to think about how I'm going to respond, I often choose not to respond, or at least I respond completely different than what my initial reaction told me to. So these are just some essential questions that I developed to guide individuals in making that informed decision or to develop an informed perspective. So first you have to pause and ask yourself, what are the facts here? What do I know about this? Okay, what are the facts? What do I not know? We always must assume that we don't know everything. Okay, we can never assume we have all the information. There is always going to be something that we can learn that will help to inform our decision. Then we ask, who knows what I don't know? This is the importance of interprofessional teams. There's always someone we can reach out to gather more information and ask for their wisdom, their insight. Do they perceive this the same way I'm perceiving it? Do they think this is as bad as I think it is? And then we have to examine our own biases, our own blind spots, and any assumptions that we have about these, because those are very real factors in things that put a barrier between us and a good decision. What are my fears? Why am I feeling this way? And then what is the true impact of this? Does it really matter? And simply asking that question sometimes can help us calm down and choose a different response. Does this really matter? Is this the hill I want to die on? And if it does matter, how much energy and time do I need to give to this? So reframing your perspective is all about looking beyond the immediate, what's facing in front of you, and looking to the future to see, is there hope that this will get better? And if so, how do I get there? What do I need to be doing to improve this situation, to improving myself? This is the hospital ward, what they called the hospital ward at Auschwitz. And the friend that I was telling you about, Eva, who was one of the Mengele twins, this was where she was taken on a regular basis to have those experiments done on her. They called it a hospital, but I guarantee you it does not look like any hospital you or I have worked in. One of the things that she told me about hope that was so important to her as a little girl that she held on to, and again, this is a very, very important protective factor for us as professionals who are living in a world right now in healthcare that is so chaotic and often seems that there's no hope for change, that we are stuck. She told me that on those trips to the hospital ward, it was the only time she saw outside, and they would put her on a gurney. And of course, she was very, very ill. And en route from her bunk to the hospital ward, she would be laying flat and looking up at the sky. And normally all she saw were these chimneys and these buildings and these fences. But she said every now and then a plane would fly over, and it would have an American flag or a British flag on it. And she said she held on to that because that gave her hope that there was more to life than what she was experiencing right now. I'm still overwhelmed when I think of a little girl of 8 years of age recognizing this. But she said she knew that there were people out there that cared about her and that were going to come get her. And she just had to survive one more day. And she told herself that every day. I'm going to survive for Miriam, and I'm going to survive one more day because they're going to come get us. And so she recognized her perspective had to change. She had to quit looking just at the walls around her, at those chimneys, and look beyond that to find hope. So sometimes we have to look beyond what we're facing right now to find hope. And we can do this collectively and together to see what are the signs of hope that things are changing for us. And how do we contribute to that and successfully move that forward? So I took this picture just a few weeks ago on one of my walks, and I think it is a great representation of hope. I was taking my walk and a storm came up, and it was a bad storm, I will tell you. It just came on really quickly, as it often does on the coast. And I looked out and there was this little fishing boat, and I thought, oh my gosh, those poor people in that boat, they have got to be terrified. And you can see the storm cloud is directly above them, and it was coming down really heavy. And I thought, I wonder what, they're thinking. I said a little prayer for them, and I thought they've got to be absolutely terrified. And then I thought, I see things differently than they do. They're just seeing the dark. all they see is this storm that they're in, and they're fighting to get out of this storm. If they could only see what I see. And when I stepped back, I saw they were almost out of that storm. If they could just keep going a little bit further, keep fighting, keep persevering, they're going to see the light. They couldn't see it, but I could see it. And I named this photo Hope. I'm getting it printed right now. I thought it was really a great reminder that sometimes our perspective is so limited because of our situation. We're surrounded by darkness on all sides. It feels like there's no hope. And this is where many of our colleagues are right now who are struggling with mental health, severe issues. I mean, it's almost every day someone is contacting me with another report of a nurse or a physician committing suicide. We've got to come together to give them hope and work for change, systemic change, to change the situations and to reduce the stigma of seeking help so that they do feel like that they can seek out these resources and utilize them to maintain that sense of hope, which is such an important protective factor. The fourth and final P is personal responsibility. We're accountable for not only for what we do, but also for what we do not do. And if you're in any type of leadership role, this is especially relevant to you. This was inside that Theresienstadt concentration camp, which for a while was used as a propaganda station for the Nazis. And at one point, the word had trickled out here to America and outside of Eastern Europe of what was actually going on in the concentration camps. And there had been a call for the International Red Cross to come in and examine to see what was really happening. Was there any truth to this, that there was genocide going on? Was there any truth about the crematoriums? And there was still a lot of doubt. A lot of people still did not believe that these things were truly happening. So they finally agreed to let the Red Cross come into the Theresienstadt concentration camp. But they were allowed several months to get things in order. So during that time, they completely renovated the camp. They sent all of the current prisoners to the gas chambers, and they brought in fresh ones from the ghettos who looked healthier and were not as emaciated. They taught the children how to play soccer. They set up some makeshift schools. You can read all about this online. There's a documentary that is truly tragic about what happened here. But one of the things that happened was they created these lavatories to show that they were receiving humane treatment. And when I took this photo, I was standing in the middle of the room, and the walls of the sinks and the mirrors is the same on the other side. So it's this big long room that had these sinks, faucets, and mirrors. When they brought the inspectors in, they proudly showed them, see, they have toilets in the other room. They have some showers. They have a place here that they can wash their hands. We even put up mirrors for them, etc. And the inspectors were so pleased with what they were seeing, and they thought, this is nothing like what we were told. They're really getting humane treatment here. And they left and wrote the report, and all of the people that were in Theresienstadt at that time were sent on to the gas chambers. They had played their role. There was a lack of accountability on those inspectors to check out the complaints that they were hearing. Not a single person walked over to test these faucets. If they had, they would have found out there was no plumbing. It was all a facade, and it was meant to fool them, and they certainly were fooled. And when we hold leadership roles in healthcare, and part of our responsibility is responding appropriately and being accountable for the decisions we make, and making sure that we do have an informed perspective, and that we're not just going on hearsay or not just taking the word of someone else. And especially related to healthcare professionals, and this is where a lot of this is going in resilience now, is that it's an active response and something that we must change the systems that healthcare professionals work within to truly address the crisis that we have. And burnout has been named a public health crisis because of its overarching effects. And it's not the individuals It is the systems, the organizations that have led to this. So we have to change the systems, and we're all accountable for our responses in these situations. For those that are nurses, personal resilience is an ethical responsibility, and the medical code has similar codes. As a nurse, I just share these because these are what I'm normally focusing on, but Provision 5 of the Code of Ethics says that we owe the same duties to ourselves as to others. So this is something that's often overlooked, but this is where personal resilience is part of our Code of Ethics. We cannot deny this. Organizations cannot deny the responsibility to promote health, safety, and well-being in their nurses. Just before last Christmas, in December of 2021, the International Council for Nurses revised their Code of Ethics to address work-life balance, resilience, professional fulfillment, safe staffing, all of these issues that we know are closely related to burnout and moral distress. And this code is having a great impact on how we're looking at the global response to this public health crisis. Essentially, what we're doing in nursing is redefining what it means to be a good nurse, but we're seeing that all across the health professions and really redefining how we look at healthcare professionals and how they own their license and how we are responsible for the care that we provide and how we look at how we interact within these systems. I'm going to go through these. There we go. So systems and situations change only when we change. And I'm speeding up so I can leave time for questions. And really, we're looking at resilience as a tool to radically transform healthcare in the United States. It takes resilient individuals to develop resilient teams, interprofessional teams, to create resilient cultures who are able to successfully move the boulder out of the road. And I'll talk about the difference between the two. And I describe it as having a pebble in your shoe versus a boulder in the road. Personal resilience is the pebble in the shoe. So the everyday challenges that we face, those acute stressors, those things that we have a difficult patient situation or, dealing with a family situation, a child passing away, something like that, that's very difficult to handle. We call on our personal resilience to help us cope effectively with those situations. Maybe some conflicts in the work environment, different things like that. But what we face with systems issues, those big chronic workplace issues, are boulders in the road. If we as individuals try to move that by ourselves, we're going to get hurt. We're not going to be able to do that. And that's where we have to develop resilient teams. And that's based on the principle of collective efficacy, that we're stronger together and we can do more together than we can as individuals. And this is where we work on changing policies, changing processes, workflows, changing the work environment, looking at leadership and how that has changed and how we need new types of leaders in healthcare. And to do this, we develop what I refer to as a resilient team, excuse me. And like I said, I use the same type of philosophy, those 4 Ps, in workshops to develop resilient teams, and just took the definition and adapted it to this perspective. Resilient teams, I say, are those that use intentional strategies to cope with challenges, adversity, and stressors, to successfully achieve their goals and objectives, and to enhance their ability to face future challenges. So it's still that growth. You're still having that potential for growth, but as a team, as an organization, that you're better after the stress that you faced because you've grown together and you've successfully faced this challenge, and then you're in a better position to face future challenges. So I've got this here, a nursing culture, but it's really any type of culture that you're trying to change begins with a resilient mindset. And I like this quote by Margaret Mead, that never doubt that a small group of thoughtful, committed citizens, us as teammates, as colleagues, can change the world of healthcare. Indeed, it is the only thing that ever has. So together, we are the ones who are going to do this, and it begins with our own personal resilience. So this is my email address. If you have any questions or if there's anything that I can provide a reference for or any information for, I welcome your comments. I will tell you that the RN P.R.E.P program that I developed has just launched nationally, so there might be a day or two delay in getting back to you, but I will respond to you. So I'm going to stop presenting now and turn it back over to Diamond. And see here.
Thank you, Tess. We do have a couple comments from the chat. Mary did ask if we could get a quick definition of moral distress and moral courage.
Oh, absolutely. And that's where most of my work is right now. I have a very large study that I just finished with 700 nurses. It's the same one. We're doing a secondary data analysis on moral distress. Moral distress is simply the inability to do what you believe is right due to organizational constraints. So there are either policies, procedures, processes that keep you from doing what you know is right. We see this in academia and we see it in practice setting as well. This has really come to light, especially during COVID. We talked about PPE, lack of PPE. We saw a lot of moral distress related to that. Safe staffing or a lack of safe staffing, the inability to care for you can't provide the right type of care because of the workload overload. Those types of things lead to moral distress. And moral distress is a very serious issue because it has profound effects if not addressed. It leads to what we call moral injury, which was something that was coined specifically with veterans. And I've done a lot of work with veterans who have been transitioning from combat to civilian life who are post-PTSD or suicide attempt, really severe PTSD. And moral injury is very prevalent there. And we're now seeing record numbers of PTSD and moral injury in healthcare professionals because of the moral distress. And this goes back to those systems issues. And really the inability to do what you know is right. So you have this huge distress inside related to that. This is where we see a lack of hope and people just drowning in that. Did I answer your question about that? Moral courage is the antidote to moral distress. Moral courage is the willingness to stand up and speak out against these constraints, even at a level of risk. And so going against the system or, saying, this is not right, we need to change this system. And we know that this requires ethical leadership, especially if there's a power dynamic and in highly hierarchical systems. We see a lack of moral courage because of a fear of retaliation or some type of punitive effects. And again, this is why we have to have resilient teams who can collectively challenge some of these processes or policies. I hope that answered your question.
Thank you so much. Yes, it did. I thought I could, infer what they might mean, but that was very helpful. So thank you.
There's a lot of great resources and articles. There's actually, I work with a group of medical ethicists that's at East Carolina University. They have a whole medical ethics department. And then a lot of our work that I do related around the Holocaust is around medical ethics. And moral distress configures huge into medical ethics and bioethics because it is essentially an ethical dilemma.
Did we have any other questions from anyone else? Okay, well, thank you so much, Tess. We really enjoyed hearing you talk about resilience and, that resilient mindset. I think we all can kind of take something away in the different types of work that we do and kind of take a moment to just think about that. I'm going to share my screen. We do have a couple more things. Yes, so Renee just posted the evaluation form in the drop form in the chat. So if everyone can please take a moment to fill that out. Yes, so you just
I see Deborah's got her hand up.
oh yes, while everyone's filling out that quick drop form, yes, Deborah. Go ahead.
Oh, yes. Well, I just wanted to thank Dr. Stephens for the presentation. And also, it's interesting to me that it sounds like there's a link between burnout at work as well and moral distress and sort of those conflicts. And it just such an important topic. And I just wanted to thank you again.
Thank you very much. Yes, there's they are intricately aligned, moral distress and burnout, and we often see that moral distress is a precursor to burnout, but they can operate in isolation. You know, you can experience moral distress and not experience burnout, but often they go hand in hand, and we see that very frequently with healthcare professionals. That the burnout is due to moral distress often. I would like to say thank you to all of you all for what you do in providing your services. I've learned so much from looking at your website, and I live in the northeast part of the state, and so I'm very familiar with Helping Hands and Friends in Need, and sorry if I'm missing on anybody else, but and I used to teach at UT, so familiar with some of the organizations there. So thank you all so much for what you do. It's a great service that you're providing for our colleagues.
Yes, and once again, thank you, Tess. And you had mentioned that this was the first part in a series of webinars. I think that you had mentioned.
I don't know. I don't remember that. I have a course that is online. It's 12 modules, and you can just email me if you want more information on that. And I do webinars for different organizations across the world, actually. So, you know, if you want more information on where I'm doing a webinar or presentation next, just shoot me an email, and I'm happy to share some of those links.
Thank you. All right, so that drop form link is in the chat, and this presentation is being recorded. So for next month, for our next training session, we are going to be hearing from 50 Forward. They're going to be sharing more information about the All of Us research program. So 50 Forward is partnering with All of Us Research, and they are helping to educate, excite, facilitate enrollment into the All of Us research program. It's a program aimed at understanding why people get sick. So their aim is to have more than 1 million people share, their health information, and kind of gather that big data. So please join us next month. It's going to be February 22nd, also on a Wednesday, for the next training session. And then just some final reminders. We do have our CHW peer learning group coming up on Friday at 10 a.m. Central Time. On Thursday, February 9th, we will have our social media webinar. So come join Renee, and she's going to teach us the basics about Facebook, Twitter, LinkedIn, analytics, and best practices. So all social media, that's going to be very interesting and very helpful. I know a lot of us definitely can always learn something new when it comes to social media. And then on, as I mentioned, Wednesday, February 22nd, we have the next training session with 50 Forward and the All of Us research program. All right. Well, thank you, everyone. Thank you for joining us today. And again, thank you so much, Tess, for sharing your presentation and helping us understand a little bit more about how a resilient mindset can, be part of our day-to-day life.
You're very welcome.
All right. Have a great day, everyone. Thank you.
Bye, everyone. Thank you so much.